Good evening, all, and thank you for giving me opportunity to present my little clinical work here. Thank you, Dr. David Oral, Dr. Michael, for giving us a guidance continuously. As you know that we have started Mission Zero Snake Bite Death in our area and saved more than 12,000 lives of snake bite victims. This I am working in north of Pune, Maharashtra, and the incidence of snake bite in that area is continuously increasing. Previously, there is only forest land, but now there are government has built 5 irrigation dams and cultivated land is increased. So also the number of snakes, the interaction of farmers and snakes is increasing. So incidence is continuously increasing in our area. We are treating all big four patients like Indian crate, Indian cobra, Russell's viper, Swasted viper. We have plenty cases of green pit viper and wall sin crate bite also in near Pune. So most of the deaths due to snake bite occur before reaching to the hospital. And as in cardiac patient, golden hour is important. In snake bite patients, sometimes we have seen golden seconds are less important. I had seen patients victims of cobra bite died on the spot immediately after the bite. It depends on the severity of the bite and where the snake was bitten. Recent fatalities in our region are 35 years snake rescuer died due to non-availability of ambulance. 6 years girl is died as he was referred by medical officer without examination. 40 years male was died on the spot while spraying insecticide. 75 years male died on working in Jawar farm. 7 years boy visited many hospital and died without any treatment. So all out of these five, three deaths are preventable. Snake bite is a preventable and very time limited and treatable condition. So we must look into the matter and accordingly we are treating the patient. Cobra bite victims can die on the spot or from few minutes to half an hour. Neurotoxicity leading to respiratory failure, cardiotoxicity, shock, hypotension, arrhythmias are the main causes, acute myocardial infarction, and sudden cardiorespiratory arrest. Recurrence in cobra bite is very common, especially in children and old age patients. Common crates present very late presentations. Along with proper primary aid, safe transportation, good communication, reduced bite to needle time, all these help save the lives of the severely unknown victims. In case of cobra bite, 40 patients, 46 patients who have studied this study of last 3 years, 40% patients admitted within 15 to 35 minutes, they required not ventilator. We have treated them only with binasal or oxygen by mask and anti-snake venom and other medical management. 8% patients admitted within 15 to 35 minutes, all arrived in cardiorespiratory arrest. 4.34 patients reaching cardiac arrest, and 56% patient admitted comatose or in respiratory failure within 1 hour after bite, and all of them required ventilator. In case of crate bite, 46% patient admitted within 30 minutes to 2 hours after bite, not required ventilator, only ASV and other management is given. 42% admitted in respiratory failure and coma 6 hours after the bite, all required ventilator. 11.11% patients admitted in cardiac respiratory arrest. So this is the huge amount. Almost 50% patients are required emergency resuscitation. In case of Russell's viper bite, cardiac arrest patient 5.28%, respiratory failure in 2.43%. Neurotoxicity is less, but still it is present. Ventilator requirement is 1.62%. We are not doing endotracheal intubation in Russell's viper bite to prevent the bleeding. So this is a 4 years boy admitted within 2 hours, 2.5 hours after the bite. He was reached to our hospital in cardiorespiratory arrest. We have done CPR, intubated immediately. We had given 20 vials of anti-snake venom. We are following strict STG or WHO protocols. Injection, neostigmine injection, atropine. He was on 24 hours on ventilator. He was extubated, but again after 10 hours after extubation, he had signs and symptoms of recurrence, neurotoxicity. Again, we have repeated 5 vials of anti-snake venom. He recovered, and fortunately, there is a birthday on his admission day, but we have celebrated that. The cobra bite with cardiotoxicity. This 63 years male, known case of diabetes, was admitted with history of cobra bite, and snake was also identified as a cobra. Reached to hospital in 30 minutes. He was conscious at the time of admission, but while starting IV, he deteriorated suddenly and developed signs of neurotoxicity. Also, he was breathless. There is hypertension, and we had given him anti-snake venom 20 vials We was put on non-invasive ventilation. We never hurry to intubate the patient, but because there are sometimes there are complications. Injection atropine injection neostigmine is given. There is neurological improvement, but at 4:30 p.m. he had a severe chest pain. At that time, ECG was normal. He had hypotension also, which is treated with dopamine injection. He is put on antiplatelet suspecting AMI. At 7:30 p.m. again, he had a classical acute myocardial infarction on the ECG with the chest pain. He was thrombolized with the teneliglipase and started low molecular heparin. He recovered fully and there is no angina. His coronary angio is not done because patient is not willing till then. This is a 75 years male female patient with multiple comorbidities, hypertension. So her coronary angio bypass graft was done. She is having CA breast and on chemotherapy. She is admitted with history of cobra bite with classical neurological symptoms and in respiratory arrest. Her saturation is only 45 at the time of admission. She was put on non-invasive ventilation. Endotracheal intubation was done, and with the protocol, standard treatment protocol and injection, soda bicarb injection, atropine, neostigmine, she recovered fully without any neurodeficit. This is a 50 years female patient with history of cobra bite while throwing garbage in the house. Suddenly, she developed blurring of the vision and giddiness. She was staying next to the general practitioner. He called us and told that she is developing neurological signs and symptoms. She reached to our hospital within 20 minutes, but relatives told that she had taken last gasp few kilometers away from our hospital. She was in cardiorespiratory arrest. Pupils were fully dilated. I was just thinking of declaring her death and sending her to post-mortem. My missus came and she said, I will try something. Then we started CPR. Endotracheal intubation is done. And after very aggressive CPR, 45 minutes, and anti-snake venom 20 vials in 20 minutes, and other emergency medical management, she started, the pulse was very feeble after 45 minutes, and she started moving eyelids and toes after 3 hours. She recovered fully. So this aggressive CPR, respiratory support and standard protocol help to save the lives of the patients. The crate bite, as I told, that they are mostly neglected and patient presents early in the morning, either unconscious or in the respiratory failure. So bite marks are not seen. Other differentials may be differentiated: stroke, food poisoning, convulsions, coma, pulmonary edema, acute appendicitis, and acute myocardial infarction. This is very interesting story. Young granddaughter and grandfather were sleeping on the floor at 11:30 p.m. The granddaughter started crying. So they suspected something else. She was in severe agony and crying continuously for 1 hour. They were searching for something in the house. They found the snake, common crate, and grandfather was killing the snake. The girl was brought initially to our hospital. While killing the snake, grandfather noticed that he was also having weakness in the left hand. So he was also brought. Simultaneously, they had a crate bite during sleep and all classical symptoms of neurotoxicity. Both were, we started 10 vials of anti-snake venom, other supportive management. At 4:30 a.m. in the morning, both had a respiratory arrest. So we are in a dilemma whom to save first, whom to intubate first. We started intubating grandfather, but unfortunately, the intubation was very difficult. I was holding the tube on the tip of the larynx. Relatives were helping to hold the patient. Mrs. Raut intubated the granddaughter, and later on we intubated the grandfather. So it was a difficult situation in a rural setting with a very resource setting. There are no trained staff in our area, and both were unconscious for 3 days on the ventilator. Both became conscious after 3 days. So this is a very challenging case. This is also a 6 years girl on the history of crate bite. She was admitted in private hospital and transferred to our hospital on the ventilator after 5 days with the history of sweating, fever, tachycardia, pulse is almost 200 per minute. She was deeply comatose at the time of admission. Deep jerks were absent. We started her on the ventilator again, treated with antibiotics and other supportive analgesic, antipyretics, IV fluids, etc. GC was improving. She started moving eyelids, moving hands. She was playing with the mobile, but some mantrik told the relatives that she is not going to survive. So they took discharge against medical advice and she died. So this is a tragic situation we have faced recently. This is also three young girls of 16 to 20 years They came early in the morning to our hospital. All were unconscious, having neurotoxic signs and symptoms. Two patients gave history of bite to the parents, but they gave some Ayurvedic medicines or water, and they neglected it. We have suspected one patient clinically as a crate bite. Two recovered on the medical management with ASVS and other supportive treatment, calcium gluconate. One required ventilatory support, and crate found in one patient's bed. So high suspicion in our areas, and all snake bite prone areas, specifically regarding crate bite, is very important. So this is Walsin crate. This is common in our Pimpri, Chinchwad and Pune area. This young doctor had a Walsin crate bite. This patient of another patient of crate bite. He was on ventilator for 10 days and required tracheostomy. So this is a difficult intubation. Patients are reaching to our hospital in a very short time because we have done a lot of awareness programs. We have good communication with the doctors. And as soon as patient reach to our hospital, we are waiting many times at the night. Patients are calling from 1 hour, 2 hour distance, 60 kilometers, 50 kilometers. And we wait for the patients. Our team is kept ready. We even ventilator and all things are kept ready, emergency management. And we are intubating them immediately after the admission, because almost 50% patients are coming in a very critical condition. This is Russell Swiper. We had seen all the signs and symptoms, but neurological complications are more in our area. And pertaining to today's topic, cardiac complications are more common in Russell Swiper bite. Though some patients have neurological signs and symptoms, arrhythmias, hypotension, shock, these are very common. The 65 years male patient had a snake bite while working in the groundnut farm. He had initially a ptosis, only neurological signs and symptoms, and he was intubated, unfortunately, in the government hospital. He had a continuous oral and nasal bleeding. He required 60 vials of anti-snake venom. We had given him all supportive treatment, including fresh frozen plasmas, PCVs. His MRI showed bilateral multiple infarcts, and he succumbed to death in the government hospital later on. So this is a okay. This I'll show the bleeding. This is a patient with neurotoxicity, Russell Swiper bite. This is oliguric renal failure. This patient had a PTCA 2 years before, and he had a Russell Swiper bite. He had hypotension, respiratory distress. He was put on NIV, developed hemiparesis after 3 weeks, and his 2D shows large thrombus in the right atrium. This patient of Russell Swiper bite had acute MI and ventricular arrhythmia, which is reversed immediately after giving ASV. Within 2 hours after giving ASV, his ECG was totally normal. This is a Russell Swiper bite patient with right hemiparesis. He was brought unconscious with convulsions. He was kept on the ventilator. Antiepileptics and other medical management is given. He had a right hemiparesis and intracerebral infarcts, hemorrhagic infarcts, and IC bleed. He recovered fully. Took 1 month for the recovery. This lady had an acute kidney injury after Russell Swiper bite. We are dialyzed her on day 3rd, but she had a convulsions, headache, and cardiorespiratory arrest on day 3rd. Again, WBCT was not clotting for 20 minutes. So we have to repeat 10 vials again. After giving, totally we had given 40 vials. She required 16 hemodialysis. So this is recurrence of signs and symptoms, just like in a cobra bite. Even after giving 30 vials, she had recurrence of coagulopathy. This study we had done, we have reduced mortality to 0%. Complications like renal failure and amputations are also very minimum. This is saw scale bite with pregnancy. This lady was also admitted in shock and in DIC. We treated her with blood and anti-snake venom, all other things. Dr. Michael visited this lady's house in very tribal remote area. These green pit vipers are also common. This child had a green pit viper bite. We are not giving anti-snake venom, but we give them resuscitation with IV fluids, antibiotics, and wound management and painkillers. So we have achieved this zero snake bite death with three pillars: early hospitalization of the patients, training of the doctors, and effective prompt management with our ABCD approach: airway, breathing, circulation, and drugs, management of shock, ASV, CPR, emergency, and intubation. So thank you. These are the awareness programs. Dr. David Worrell is kind enough to guide us and help us in this mission. This is the first get together of the snake bite victims in our area. 150 snake bite survived snake bite victims attended, and that time Dr. David Worrell guided us for doing awareness programs. So these are acknowledgements: Dr. David Worrell, Dr. Kenny sir, Dr. Julian White, Dr. Michael, many others, Dr. Mrs. Mehta. These are the survived victims of the snake bite. So I'm working in my hospital also and government hospital also, totally free of cost since last 25 years. Thank you very much.